New AARP survey shows family caregivers need more support, and based on conversations I've had with reporters in the state, namely like Anne-Marie Timmons over at the New Hampshire Bulletin, it's obvious more needs to be done to support these communities in the state, whether it's the people being cared for or the caregivers themselves, which obviously it's a very hard gig that I could not imagine doing in addition to everything else that happens in their lives. And I'm excited today to be joined by Christina FitzPatrick. She's the state director for AARP New Hampshire. Welcome back to now the New England take. You previously on WKXL in the morning. I appreciate you taking the time.
Oh, I'm happy to be here.
So AARP, I'd imagine you have a fairly prevalent need to have these people taken care of that are responsible for many elderly, not necessarily all elderly, but people that are 50 and up really need more advanced care.
That's right. So we're looking at this caregiver work and the importance of family caregivers from both the perspective of the people who are providing care and the people who need care. Because it's pretty safe to say that almost all of us will either provide care or need care or have provided care. You know, this is a universal thing, and it doesn't have anything to do with the ideology. This is just about a very challenging time in people's lives when they are providing care for an adult, because childcare is very important also, of course. But what we're focused on is family caregivers who are providing care to an adult loved one.
And definitely post-COVID, it's definitely exploded where a lot more people are realizing, hey, I don't want to be at the mercy of whatever facility I'm in. Rules change over time. So I've had a conversation with Granite VNA previously about what their work over there. It's people want to stay in their home as long as possible, and there's needs that need to be fulfilled for that to be a successful experience for everyone involved.
That's right. People overwhelmingly want to stay at home. There are times when people need to be in a higher level setting, like in a nursing home or some sort of assisted living facility. Sometimes they have health needs that can't be avoided. But for the most part, people want to stay at home, and it makes sense because that's where they have relationships. You know, they have their friends, they have their activities in the community, maybe they live near their family, and so they want to stay there, and we want them to stay there because we know that when people have strong social connections, it is good for their health.
Yeah, and the numbers show that too. This isn't some anecdotal thing. Like,
right.
People who have communities are able to spend time with their grandchildren, are able to go to the bingo night or whatever it may be. Sorry for stereotyping. They recover from illnesses quicker. They live longer, and it's so important. I mean, on the caregiver side of it, is there an estimation how many family caregivers there are in the state?
Yeah, we did some work. AARP did some research, and we determined that there are about 168,000 family caregivers in New Hampshire, and that they are providing $2.8 billion worth of care. So if these family caregivers weren't providing the kind of care that they are, these families and the government programs and things like that would have had to pay out $2.8 billion more than they did. So these family caregivers are providing just essential services, both to help their loved ones stay in the community, but then also to make the long-term care system work. You know, without family caregivers, it just wouldn't work.
Yeah, I mean, you talk about all the facilities that have been overwhelmed the last few years because of lack of staffing and everything. Is another reason why it's important for people to be able to have home care options like this. I mean, what are some responsibilities that family caregivers are able to offer, and what challenges do they face?
The kinds of activities that family caregivers perform really runs the gamut. So it can be everything from going and buying groceries for your loved one and bringing those home, taking people to the doctor, making sure their house gets cleaned, things like that. But they might all have to administer medicines, administer injections, change bandages, do ongoing, really health-related care. And then there's all the coordination that needs to happen with insurance companies and doctors' offices and things like that. So all of this takes a really, really long time. So it's time-consuming. It's emotionally difficult because you are watching someone you love having a severe health condition. And sometimes these things come on really drastically. Somebody has a stroke or something like that. And so one day your life is going one way, and the next day you're trying to figure things out about how to make sure that your loved one gets the care that they need. So it's this emotional burden as well. And there can also be a really big financial burden of people spending their own money to help provide care, or 60% of family caregivers are in the workforce. They have jobs, and some of them have to leave those jobs because the family caregiving demands are so big, or they cut down their hours because it's just too hard to balance a full-time job with the caregiving responsibilities that they have. So it really hits people on multiple fronts. That's exhausting. It's exhausting, it's emotionally difficult, and it really has strong, big financial implications.
Yeah, I've had members of my family that have needed to provide care for family members who, like my grandmother, she had a stroke a few years back, and then back and forth, my mom was having to go 2 hours away to get her to an appointment on a regular basis. And it's like, just because you're not next door to the relative doesn't mean that you're not going to try and do everything you can to take care of them. The tremendous time and financial impact of, it's all the miles on your car that you're putting in, the economic impact that has on you, having a garage that's able to take care of it. Like, there's far-reaching economic implications of these sorts of things. I mean, what's AARP hoping to improve for these caregivers?
It's important to recognize that there are some progress that's already been made. So, for example, earlier this year, President Biden issued an executive order to have the federal agencies focus more on supporting family caregivers, both caregivers of children and caregivers of adults, and having the agencies look at what they can do to increase support for family caregivers. Here in New Hampshire, the legislature during the most recent session included some items in the budget that are part of what we're calling the System for Healthy Aging. I'm not quite getting that name right, but it's a system where we want there to be a system so that there's a continuum of care. So if you need a little bit of care, you can get a little bit of care in your home. And then as your needs progress, the care that you receive and the help that your family caregiver is able to receive increases. And then ultimately there are nursing homes that are fully staffed and able to provide quality care. There are a few other things that would really help caregivers as well. So as we were just talking about, that there are really big financial implications. So there are things that can be done to provide financial resources to caregivers. Employers have a role here too. Like, if everyone had access to paid family leave, then people could take on these responsibilities without having to worry about losing their job, particularly when you're at the very beginning, when you're trying to figure things out. It's a full-time job to do that. They can also offer flexible paid time off, so sick leave, like not just for you, but so that you can take your father to the doctor, or whatever needs to be done. And we also need to make sure that family caregivers have respite care so they can take some time off, because if you're on 24/7, you will burn out. And we know that depression and isolation and things are difficulties and challenges that family caregivers face. And then finally, this trying to help people stay in their homes. There's a lot of different kinds of services that people need, whether that's transportation to get to and from doctor's appointments or to and from the grocery store, or getting somebody to come in and provide personal care services, so helping people get dressed and undressed and get into bed, take a bath, things like that. There are a lot of different kinds of services that people need in the home that come from a lot of different providers. So it's really important to help caregivers know where to go to find these services and have some kind of coordination there as well.
What are some ways that caregivers can go and find help? I mean, I make no bones about my day job. Like, the big thing we have over there is people don't know there's resources available for different aspects of the systems, whether it's questions in the workplace, whether it's the person I'm caring for is having an issue and I don't know how to address it. What are some suggestions you have for them?
The state of New Hampshire has a great resource. It's called Service Link. And if anybody just Google Service Link New Hampshire, you will be taken to a page. And the role of Service Link is to do exactly what you're talking about, is to listen to what people need and then give them advice for how to find it. I would also encourage people to go to an AARP website. It's aarp.org/caregiving. And there's a link to each state. So there you can click to a New Hampshire state page that lists a ton of resources for the different types of help you might be looking for. And so that's a great place to start and look through it and find some information and start going from there.
And it's unrelated to AARP and what we're talking about right now, but kind of related. I'd also suggest if you have youth that you're caring for in these situations also, please check out New Hampshire Children's Trust. They're in no way affiliated with AARP, but they do fantastic work, and I've had them on the show before, and they have tons of resources if you're talking about young people that are maybe being cared for instead of people on the other end of the age spectrum.
Yeah.
So this is so important. I mean, where should people go if they want to learn more about the work you guys are doing from an advocacy standpoint?
We have on our New Hampshire AARP website, which is aarp.org/nh, we have a great roundup of our legislative victories in the most recent legislative session. Which includes the System of Care for Healthy Aging bill that I was speaking about earlier. There was an increase in Medicaid reimbursement rates, which pays for a lot of long-term care in this country. And there, as you referred to earlier, there are big staffing shortages, whether you're talking about in nursing homes, hospitals, assisted living facilities, home care agencies. And so there have been some steps taken to try to recruit more people and have them stay in the field so that they can provide these important services.
Yeah, the apprenticeship programs of the community college system has been pioneering are fascinating. Definitely look into that. If you know a young person that wants to get into the field and maybe doesn't want to spend the next 8 years trying to get to that point, they can actually start working in the field in these apprenticeship programs. So I would suggest you check out the New Hampshire Community College System for some information on that side. So we definitely need more healthcare staffers in the state.
We do.
Yeah, so granted, VNA I've also talked to, like I said, and they're always looking for staff. So if you want to get into the healthcare field, there's plenty of openings right now. Please look into it. All right, Christina FitzPatrick, State Director of AARP New Hampshire. Thank you so much for joining me.
Thank you. I really enjoyed it.
TheNewEnglandTake.com to get all of our episodes, and check out the YouTube channel. Like and subscribe if you're over there. And we also post all our episodes as audio only on all major podcast platforms if you search for The New England Take. Talk to you soon.